New medical advances and a better understanding about how our medications work mean that those of us with heart and circulatory diseases will be able to live longer and healthier lives. But first we must learn to take our medications safely and effectively. This video has been developed to help you understand more about Coumadin and your medical condition. Two medical experts, Dr. Malcolm Brigden, head of the Thrombosis Interest Group of Canada and head of Oncology and Regional Medical Oncologist-Hematologist at Penticton Regional Hospital in Penticton, British Columbia, and Dr. Reginald Smith, Clinical Pharmacy Specialist in Cardiology and Cardiac Surgery at the Royal Jubilee Hospital in Victoria, and Clinical Instructor, Faculty of Pharmaceutical Sciences at the University of British Columbia in Vancouver. We'll speak to you about the following important issues: what Coumadin is and how it works, the conditions for which Coumadin is prescribed, how your Coumadin dose is determined, some of the dietary precautions and lifestyle changes that you need to be aware of, how Coumadin is administered and how to take it as prescribed, what to do about other medications that you may be taking, how to recognize and how to deal with possible side effects of Coumadin, precautions to follow when undergoing dental and medical procedures while on Coumadin, how long will you be taking Coumadin, and how can you get extra information about your condition and your Coumadin therapy.
Hello, I'm Dr. Malcolm Brigden, a specialist in blood diseases. Today I'm going to talk to you about the drug Coumadin in terms of what it is and how it works, the indications for which it's commonly prescribed, how you can get the best results from this drug in terms of what you do with your diet, how long you would be on Coumadin, how your dose of Coumadin is actually established, and how you can find out more information about Coumadin and your medical condition. Coumadin is a drug that interferes with clotting by interfering with the liver's ability to make clotting substances. It does this by interfering with vitamin K. It is often referred to as a blood thinner, but in fact, it simply decreases the blood's ability to clot. Normally, we form small blood clots all the time, but usually the body dissolves these on its own. However, in some situations, such as when damage occurs to blood vessels or with various diseases or illnesses, a large blood clot can form in a vein or artery. This clot may block off the blood flow, or a piece can break off and travel to another area of the body, such as the heart, lungs, or brain. Obviously, this can be quite dangerous. Coumadin has less of effect on clots that are already formed. It actually works by inhibiting the formation of new clots and allowing the body to naturally dissolve the clots that have already formed. Coumadin is prescribed for a range of medical conditions in which the body's natural ability to deal with blood clots may be lessened. Blood clots in the leg, also known as phlebitis, is a common condition for which Coumadin is prescribed. Coumadin is also prescribed for some patients who have artificial valves to prevent clotting around the heart valve. Patients who have had a heart attack may also benefit from receiving Coumadin therapy to prevent further clots. Coumadin may also be prescribed for patients with an irregular heartbeat, such as occurs with atrial fibrillation. Some people with an irregular heartbeat may experience an increased number of flutters or palpitations, which may feel like butterflies in the chest. This condition may result in clots which travel to the brain, possibly causing stroke. Finally, Coumadin is often used for people who have disease involving the blood vessels of the brain, which may result in stroke or brain attack. In order to determine the amount of Coumadin that you require on a daily basis, your doctor will arrange for you to have a blood clotting test called prothrombin time, or PT-INR. This involves going to a lab and giving a tube of blood from your arm. The PT represents the time it takes your blood to clot. It is reported as an INR, or International Normalized Ratio. In most cases, your doctor will be trying to keep your INR somewhere between a value of 2.0 to 3.0. The range for mechanical valves may be greater. In order to improve effectiveness and prevent possible side effects, your doctor will arrange for you to have INR tests on a regular basis. In the beginning, when you're just starting on Coumadin therapy, this may require testing several times a week. Later on, when you're stable on Coumadin therapy, every 3 to 4 weeks may be sufficient. Following an INR test, your doctor may call and ask you to change your Coumadin dose.
It is important to keep the amount of vitamin K in your diet relatively constant because Coumadin works by interfering with vitamin K. Green leafy vegetables such as broccoli, spinach, and Swiss chard, and some herbs such as coriander, parsley, and mint are especially high in vitamin K. There is not a problem with including any of these foods in your diet, but you should try to keep your average weekly consumption of them approximately the same. You definitely should not binge on any of these foods. Your doctor, pharmacist, or dietitian should be able to supply you with a list of foods high in vitamin K. Some vitamin preparations, such as multivitamin pills, may also have significant amounts of vitamin K. So let your doctor know if you are taking any other supplements or vitamins. You should also tell your doctor if you are on a special diet or if you plan to make any significant changes in your diet. Alcohol may affect the action of Coumadin, but it is not necessary to abstain from moderate alcohol consumption, such as a glass of wine with dinner. However, if you significantly increase or decrease the amount of beer, wine, or hard alcohol that you drink, you must tell your doctor. Finally, you should inform your doctor if there is any significant change in your lifestyle, such as weight gain or marked change in exercise pattern.
Hello, I'm Dr. Smith, a pharmacist, and I'm here to talk to you about how Coumadin is administered and how to take it as prescribed, what to do about other medications you're on while using Coumadin, how to recognize and deal with side effects of Coumadin, and what to do about medical, dental, and surgical procedures you may have to undergo while on Coumadin. Coumadin comes in tablet form. The tablets are available in different strengths to make dosing easy. The strength is imprinted on each tablet. Each strength comes in a different color. Since the dosage of Coumadin can frequently change, always remember to check both the strength and color of the tablet prior to taking each dose. Coumadin can be taken in the morning or at night. It's important to take Coumadin exactly as prescribed. However, it may be easier to take it at the same time each day. This will help you get into a routine so that doses are not missed. You might also find it useful to use a dose calendar, which may be available from your pharmacist, to write down the results of INR tests and the Coumadin dose taken each day. If you miss a dose, take it as soon as you remember. But if it's close to the time of your next dose, do not double up. If you miss taking your Coumadin for 3 or 4 days, call your doctor for advice. Do not stop taking your Coumadin unless told to do so by your doctor. It may have severe consequences, such as a stroke or brain attack. Many prescription and non-prescription drugs can either increase or decrease the effect of your Coumadin. If you start a new medication, your dose may need to be adjusted and you may have to go for more frequent INR tests. It's important for your doctor and pharmacist to have an up-to-date list of all your medications. It's a good idea to get all your prescriptions filled at the same pharmacy. Then your pharmacist can be aware of all medications you're using. The most common class of drugs which can increase the effect of Coumadin are aspirin and other anti-inflammatory drugs such as ibuprofen. Since aspirin is in many over-the-counter products, always seek the pharmacist's help in selecting non-prescription medications. For headaches or fevers, use acetaminophen. Anti-inflammatory drugs, which are often used for arthritis, can increase the risk of bleeding into your stomach while you're using Coumadin. Do not take aspirin or anti-inflammatory drugs unless they've been specifically prescribed for you by your doctor. Coumadin is a safe and effective medication. As with other medications, it must be taken as prescribed. If you take too little Coumadin, it won't work properly for you. If you take too much, you may experience side effects. The most common side effect of Coumadin is minor bleeding, which may show up as bruising, bleeding gums when brushing your teeth, or nosebleeds. More serious side effects, which are less common, are blood in the urine or stool, or vaginal bleeding. You may also find that if you cut or nick yourself, you may bleed more than usual. If you notice any of these signs, call your doctor. You may be more prone to bleed from a bad fall while on Coumadin therapy. This doesn't mean you have to restrict your physical activities, but you should certainly avoid contact sports. If you happen to fall and hit your head while on Coumadin, call your doctor. You should always inform your dentist and other doctors that you are taking Coumadin. Many people who take Coumadin, such as those with mechanical heart valves, may require antibiotics before certain medical procedures. If you require surgery, your Coumadin may have to be stopped in advance and another drug used in its place. It's a good idea to get a medical alert bracelet that states you are a Coumadin patient. In an emergency, a medical alert bracelet will tell ambulance and hospital staff that you are a Coumadin patient. Bracelet application forms may be found at most pharmacies.
One of the most often asked questions is, how long will I need to be on Coumadin? Dr. Brigden explains.
The length of time that you have to take Coumadin largely depends on the underlying condition. If you have suffered from clots in the legs, several months of therapy may be adequate. However, if you have an artificial heart valve or an irregular heartbeat, you may have to take lifelong Coumadin therapy. It's always a good idea to write down any questions you might have about your Coumadin therapy or your underlying medical condition. Your pharmacist and doctor will then be better able to deal with your concerns. Your doctor and pharmacist will also have pamphlets and other reading material. Aftercare, a special program for patients taking Coumadin, is also available through your doctor. Your doctor can register you in the aftercare program. You will initially receive a starter kit which includes 2 pamphlets, Anticoagulation Therapy in You and Questions and Answers about your anticoagulant. In addition, you will receive your Coumadin dose schedule and a dosage calendar. About every 3 months, you will receive an aftercare newsletter which will bring you advice, news, and motivational articles to help you manage your treatment while enjoying a healthy lifestyle. Please remember, if you have any questions at all regarding your Coumadin therapy or your underlying medical condition, contact your physician or pharmacist.
As Dr. Brigden and Dr. Smith have pointed out, Coumadin is a safe and effective drug when used properly. Here are some of the key points they talked about. Coumadin is prescribed for a number of medical conditions when it becomes necessary to reduce the ability of the blood to clot. It is important that you take your Coumadin pills exactly as prescribed. Remember to check both the strength and the color of your tablets. Notify your doctor and pharmacist if you change your intake of vitamin K and alcohol, as they can affect the way that Coumadin works. Also report if you take any new prescription or non-prescription drugs. Notify your doctor or pharmacist if you experience bruising, bleeding, and other injuries, such as a blow to the head. Also report if your lifestyle changes, such as increasing your level of physical activity or if you gain weight. Do not use aspirin unless it is specifically prescribed. You should inform all your healthcare providers that you use Coumadin. Don't forget to tell your dentist It's not always easy to follow the advice and instructions, but the inconveniences that they cause are lessened by the knowledge that Coumadin is safe and effective when you follow instructions. Remember, if you have any questions at all regarding your Coumadin therapy, please call your doctor or pharmacist.